Hello, everyone, and welcome to the Douglas Laboratories educational webinar. Today's topic is maintaining memory with age, applying effective nutritional strategies in practice. This is part 2 of 2. So if you did miss part 1 by Dr. Kelly Hine, which was also titled Maintaining Memory with Age, the Neurocognitive Benefits of Polyphenols, then you can visit douglaslabs.com to review that recording. Today's presenter is Dr. Martin Gallagher. Dr. Gallagher has the unique distinction of being triple licensed as a board-certified family physician, a chiropractor, and a medical acupuncturist. He is the clinical director of the Medical Wellness Associates, a multidisciplinary integrative healthcare facility located outside of Pittsburgh, PA. He is an international lecturer and has authored several books, including the best-selling Dr. Gallagher's Guide to 21st Century Medicine. My name is Christabel Lovick, and I'll be your moderator for today's webinar. We will take questions at the end, but please submit your questions anytime throughout the webinar, and you can submit them on the screen. You'll see a go-to toolbar. And there will not be any handouts today, but this webinar will be recorded for viewing again at a later time. So let's go ahead and get started. I'd like to now turn it over to you, Dr. Gallagher.
Thank you, Christine. Great to be with you this evening and discussing memory, about how to maintain it and also how to improve it, because we have a lot of patients coming into our offices, and I'm sure throughout the world, of people with mild to moderate dementia or moderate to severe dementia. And we have about 40 million Americans that are on that timeline to have severe dementia over the next 20 years. So we obviously have to take strategies that improve brain function. So that's what we're going to talk about tonight. As a step regarding disclosure, I'm a paid advisor for Douglas Laboratories, and I have no other interests whatsoever. The objectives are to review how memories form and the functioning of the central nervous system, and understand what contributes to normal memory decline, and learn what dietary and lifestyle factors and research of nutrients and ingredients that help to improve brain function and slow down the aging process of the brain. So first we have to talk about memory and aging, that it's a gradual process, and like any condition, whether it's osteoarthritis or progressive cellular decline, the brain undergoes changes that lead to pathologies. One of them, of course, is neuronal changes. That's accumulation of non-essential substances, loss of the myelin, and shrinkage, much of which has to do with chronic inflammation in the brain. And the connections that are made between neurons become altered, so that you actually have reduction of the branching and the reduced numbers and the interference ultimately with neurotransmitters. So our neurotransmitters aren't going to function if there is reduced branching and reduced numbers. So we have to have the brain optimized. And of course, there's circulatory considerations. As people age, there's changes of blood flow. Some people with increased risks of cerebrovascular disease have altered blood flow, and that may be major blood vessels as well as minor blood vessels, resulting in change of brain function. So if we take a look at the structure of the neuron, which you can see on your slides, we have the very important cell body to the left with all its branches coming off. The branches are the dendrites, receiving messages from other cells. And then from the cell body, we can follow down sort of like looking like little vitamins. This is the axon, passing the messages from the cell body to the various terminal points in neurons and muscles and glands, and covering it is the myelin sheath. So we know quite a bit about the myelin sheath, particularly in diseases like multiple sclerosis, degenerative changes taking place in the myelin sheath. So we have nerve signals, neural or neuronal signals. So how is it that they work? We have neurotransmitters that are released, and they bind to the ionotropic receptor. You can see that on the slide. Ions flow into the postsynaptic neuron, depolarizing the membrane. So it's all about activating the cell membrane. And then the signal ultimately reaches its target, where a response takes place. That doesn't really create memory. I mean, there's other factors that contribute to that. But once the neurotransmitter is released and binding to a metabotropic receptor produces a second messenger, which alters the nerve function. As an example, that activation of protein kinases cause prolonged changes in the neuron, like the activation of certain genes, and therefore protein synthesis results in formed memory. So it's not just a matter of transmission, but it's also metabotropic receptors have to be activated, second messengers have to take place, and there has to be a footprint made for memory. So in a clinical practice, you have to think, well, what's really going on? What contributes to a person's memory decline? When they say, I just can't focus, I can't remember, I feel like I'm getting Alzheimer's disease, think in terms of inflammation and biomarkers. The majority of people that have these illnesses have chronic brain inflammation, and there's tests that you can do, things like C-reactive protein and TNN alpha and ACT and MCP1 and the interleukins 6 and 10 and 18 and APOE. So there's markers that you can use in your clinical practice, blood tests, various serum markers that can tell you about inflammation. If a person is chronically inflamed, there's neuronal destruction that takes place, lymphatic congestion, poor transmission of nerve impulses, and a decline of neurotransmitters. So getting that part of things straightened out in turn decreases inflammation and hence improves memory. So what are the contributing factors, and what are the factors that we can consider for people that have progressive memory decline? Well, look at the American diet. So if a person's eating a high sugar, high refined carbohydrate diet, that's going to cause inflammation, disturbances in their blood sugar, contribute to diabetes type 3, which is basically cerebral diabetes. These all contribute to loss of memory, loss of cognitive function. And of course, trauma and mechanical stress. Automobile accidents, falls, post-concussive syndrome, the way children are delivered, traumatized in the head and neck. So trauma and mechanical stress can cause changes in brain function. Obesity and diabetes and coronary artery disease, so inadequate circulation, as well as diabetes and type 3 diabetes from eating a high carbohydrate diet. You may have a genetic risk factor, so you may have polymorphisms. You may have certain types of genetic SNPs that predispose you to memory decline, but oftentimes that can be overcome with lifestyle modification. Look to the role of food allergy. So we oftentimes run food allergy tests. We test people for heavy metals like a toxic metal challenge, such as mercury, lead, arsenic, aluminum, tin, even gadolinium. A lot of doctors run MRI studies checking the brain for memory decline, but the gadolinium itself can be an inflammatory toxin in the brain. Gut dysbiosis. We are all aware now of the relationship between the gut and the brain. They speak to each other via the vagus nerve. So if the gut's inflamed, the brain can become inflamed. So there's a gut-brain relationship. So small intestinal bacterial overgrowth, maldigestion, malabsorption will contribute to memory decline. Fungal infection. Most people have been exposed to excessive antibiotics, birth control pills for women, cortisone and sugar in the diet, the ABCs, big contributing factors to chronic fungal infection, which in turn can lead to a lot of memory loss, brain fog, agitation. Prescription drugs and OTCs. If we can see that correctly prescribed prescription drugs are the leading cause of death in the United States, then we can certainly say that neuronal death and neuronal inflammation can be a byproduct of taking prescription drugs, OTCs, as well as recreational drugs and alcohol. Aging and hormonal deficiencies. We have people all the time that say, I stopped my menstrual cycle. I'm, going through change of life, and I notice that my memory isn't good anymore. I feel like I'm getting Alzheimer's disease. So the decline of hormones, especially estrogen, progesterone, testosterone, DHEA, are major contributing factors. And of course, the average American has one less hour of sleep per night compared to the counterpart 20 years ago. So lack of exercise and lack of sleep are major contributing factors. How does that manifest? All the medical specialties end up having patients coming into their office that have chronic inflammation. In neurology, we know this as dementia, Alzheimer's disease, MS, migraine headaches, rheumatology with the arthritides, GI doctors with IBS and irritable bowel disease, dermatology with chronic skin conditions, cardiology with coronary disease, CHF, ophthalmology with cataracts and uveitis, macular degeneration. So what we can say really is that chronic inflammation, which is linked to the lifestyle factors that I mentioned, which can be identified to some degree through biomarkers, are the things that you really have to consider with patients that have memory decline, and then what plan you're going to develop to help them overcome these problems and regain their memory. Look no further than the microbiome. The microbiome now, the human microbiota consists of 10 to 100 trillion symbiotic microbial cells harbored by each person. So the human microbiome consists of the genes these cells harbor, with a large proportion living in the colon and small bowel. So we have a gut-brain relationship. In fact, the majority of the neurotransmitters are made in the gut. 100 million neurotransmitters line the gut, which is approximately the same number found in the spinal cord. And every single type of neurotransmitter that's found in the brain is found in the gut. Serotonin plays a major role in depression, anxiety. All we have to do is look at the amount of medication that's being prescribed for depression and anxiety. We need to look no further than that. Could this be due to gut inflammation? So there's a gut-brain connection, right? There's tight junctions in the gut. And so if your gut becomes inflamed because of eating the American diet, the toxins that I'm speaking of, antibiotics, anti-inflammatory drugs, GMO foods, that inflammation leads to a opening, a widening of the tight junctions that are in the gut, and the gut becomes leaky. That leads to chronic inflammation. That increase in intestinal permeability is called leaky gut. We also know that there's a barrier as well in the brain. So the blood-brain barrier can become compromised as well. And so those toxins, poisons, inflammatory byproducts can absorb, cross the blood-brain barrier, and lead to chronic brain inflammation. So that many of these diseases can be befriended by getting a healthy gut and a healthy brain. The leaky gut impact on cognition. We have a neurotoxic insult like heavy metals. There's over 110 sources of lead in the environment, over 100 sources of mercury, let alone the mercury fillings in your mouth and the kind of foods that people consume. Then viruses, funguses, bacteria, Lyme, MSG, pesticides, herbicides, solvents. There's tens of thousands of chemicals. They in turn destabilize the tight junctions of the blood-brain barrier, and the byproduct of that is chronic inflammation, which then leads to neurological diseases. Maybe it's not Parkinson's or severe dementia, but it may be memory loss, focus, concentration difficulty, feeling like you just have a brain that just doesn't operate properly, you can't focus, or chronic pain. Remember, all pain is registered in the brain first. So in Alzheimer's disease, the current concept is neurogenic inflammation versus amyloid deposits. We all have heard that, that Alzheimer's disease is because of amyloid deposits. But more research is coming out that the activated microglia are seen in abundance in postmortem AD patients. So the current thought is that the presence of inflammatory cytokines compromise the brain, and the microglia can't phagocytize the amyloid beta, which then leads to accumulation. So, the amyloid is actually a byproduct of the chronic inflammation that's taking place. So saying, well, if we get rid of the amyloid beta, that's the solution to the problem, that's just really the effect. We have to decrease inflammation. So the neurogenic inflammation concept is that the CNS is immunologically privileged. We have peripheral immune cells are normally blocked by the blood-brain barrier, but neurogenic triggers like what I've been talking about, like toxins, poisons, metals, etc., compromise the nerves, the neurons, which in turn lead to problems with microglia and then accumulation of toxic substances. Now, this is also linked to dementia, migraine, seizures, numbness, weakness, and other kinds of difficulties. So in the Alzheimer dementia model, major hallmarks are neurofibrillary tangles and amyloid beta plaques. The neurofibrillary tangles are insoluble aggregates of tau proteins, and the amyloid beta plaques are extracellular deposits of the amyloid. And you can see the MRIs down below. So what can we do? You know, a patient comes to your office, they're 65 years of age, postmenopausal by 10 years, frequently tired, have difficulty focused, concentrating, and remembering, impaired sleeping, waking up in the middle of the night, oftentimes has joint pain, memory issues. So what are you going to do? We need to think in terms of changing the patient's diet. The ideal thing is getting low in carbohydrates, high in fats. The brain is about 70% fat, so we need fats in the diet. Make lifestyle changes, like get the person exercising. And then the key ingredients, we need phosphatidylcholine, phosphatidylserine, acetyl L-carnitine, vinpocetine, DHA, EPA, curcumin, polyphenols, and methylated resveratrol. Those are some of the key ones that you're going to want to think in terms of prescribing to your patients, along with the lifestyle modifications. The choline, phosphatidylcholine, phosphatidylethanolamine. This supports the synthesis of phosphatidylcholine, which is a phospholipid precursor for cell membranes. So if you want to have a healthy neuron, you have to have sufficient amounts of raw material. And remember that the neurotransmitter acetylcholine, which is involved with mood and memory and muscle control, is in part an outgrowth of choline. So we have to have this structural substance as part of our diet and supplementally to our diet, so that we maintain the integrity of neurons and promote cognitive function. The studies that I've listed below indicate that. So choline studies have found in double-blind placebo-controlled trial over about a month and a half, using 1,000 milligrams a day, with the average age of the person 72 years of age. The results of choline therapy supported immediate and delayed PROS recall relative to baseline. And this was confirmed with increased choline levels. So as you increase the choline, you also improve the person's ability to remember and recall events. Acetylcholine is an important neurotransmitter, declines in people as they age, has a big impact on memory. So phosphatidylcholine, which is the main ingredient in lecithin, is important to use with your patients supplementally to their diet. Phosphatidylserine as well, naturally occurring in things like egg yolks. It's important in phospholipid membranes of the neurons. So this is the structural integrity of the brain cells, the cord cells. And phosphatidylserine comprises a small percentage of the biological membranes, but that small component may be critical in the membrane potential of neurons. So to really get the neurons firing properly, you have to have phosphatidylserine. So phosphatidylcholine, phosphatidylserine should be part of your drugless prescriptions. The mechanism of phosphatidylserine, PS, membrane and its receptors are critical for the neural signal to reach its target. So if you don't have that, if you don't have sufficient amount of phosphatidylserine, you're going to get a rigid membrane and you're not going to get the message across. So it's sort of like a person, their brain starts declining. You've read studies, for instance, like phosphatidylserine, B12 deficiency, causing shrinkage of the brain. These all have to do with rigidity of the membrane. The studies have found in double-blind placebo-controlled studies for 2 to 6 months, people 55 to 88 years of age, taking 300 milligrams a day, memory tests showed modest improvement. So you can get improvement of total recall. Now remember too, that's isolating a single supplement. You really need to think in terms of the whole enchilada, changing the diet, exercising the patient, low carbohydrate diet, the vitamin therapies that we're speaking about, using them in combination. Acetyl L-carnitine, I'm sure that you use with patients that have cardiovascular disease, supraventricular tachycardia, hypertension, athletes that have muscle fatigue easily, don't recover from exercise. This is an amino acid, turns on your mitochondria, supports neuronal health to promote memory, emotional well-being, and cognitive function. So you can take a look at this in the American Journal of Clinical Nutrition. for further review. But the purpose of this is the transport of substances across the mitochondrial membranes. So you want to make energy in your muscle, the heart muscle, in your neurons, in your heart. To do that, you have to have sufficient amounts of carnitine, especially the acetyl L form. So it's needed to produce structural changes that are essential to turn on your neurons and for protection of the synapses. So very important for the growth of your nerves and to repair nerves that have been damaged. Vinpocetine is a common nutritional supplement that you should consider using. It's a nootropic supplement derived from vincamine, extracted from the periwinkle plant. You probably have seen it in some of the nutritional formulas you're prescribing to your patients. Introduced into clinical practice about 20 years ago. It helps to support increased cerebral blood flow. So if we go back and take a look at some of our markers, we talked about, or risk factors for Alzheimer's disease and dementia. One of those is cerebrovascular problems, inadequate blood flow, ischemia. So vinpocetine and other nutrients like methyl resveratrol, ginkgo biloba, dilate blood vessels. So you have small blood vessels that become diseased that begin to function better, more activity going on in the brain. So it helps to support healthy blood-brain flow and turn your neurons on. So it increases cerebral circulation. Of course, DHA is extremely important. It's the principal polyunsaturated fatty acid in the nervous system, and its formation slows as we age. So studies have shown that this fatty acid helps to maintain nerve function and cognitive abilities by supporting neuronal structure. So if you combine, for instance, phosphatidylcholine, phosphatidylserine, and then you have DHEA, well, now you've got structural proteins and you've got fats so that your brain can repair and your brain can communicate from one nerve cell to the other. Very important. You're also decreasing inflammation in the brain. Polyphenols in cognition. So in the first conference, the doctor spoke quite a bit about the importance of things like polyphenols to have an anti-inflammatory effect on the brain. Polyphenols promote daily cognitive function, improve emotional wellness. So these are the flavonoids, including anthocyanins, EGCG, like the green tea. So drinking green tea, taking this as an extract as well, proanthocyanidins, and curcumin. So the preclinical data tell us that polyphenols support neuronal stability and function. So this is very important and acts as an important antioxidant in the brain. So if your brain's inflamed because of lack of antioxidants and eating the American diet and taking medications and a leaky gut, so you've got a gut-brain inflammatory reaction going on, you need to put these nutrients in to help to salvage the cells in brain. Curcumin, many of you I'm sure are prescribing either turmeric or curcumin. Curcumin, of course, is the active ingredient found in turmeric. It's another one of the polyphenols in plant extracts. There's double-blind studies that have looked at just simply using a gram of curcumin a day. It promoted relaxation based on the Beck Anxiety Inventory. So don't think of it just as something that you give to patients that have cancer or arthritis or joint pain or back pain. Also people that have problems with mental alertness and anxiety. 30 days of using 400 milligrams of Longvita. This is the form of curcumin that has been bound with phospholipids. So it bypasses the liver because most of the curcumin ends up in the liver. It gets glucuronidated and you don't get the big effect. So you want to make sure it's in a phospholipid complex. Curcumin supports healthy vascular function. You get increased production of nitric oxide. It downregulates inflammation and provides important antioxidant status. This is a great study at Ohio State that you might want to have for additional edification. Even in healthy adults, because now you also have a group of patients coming into your office that are 50 years of age and older that say, you know, I don't want, my mother has Alzheimer's disease. I don't want to go down that pathway. I'm feeling pretty good. I'm a little tired, a little stressed. I could be a little bit less anxious, a little bit more alert. Well, this looks at a double-blind, randomized, placebo-controlled trial in which curcumin, in the form of Longvita that I'm speaking about, it looked at things like fatigue, alertness, calmness, contentedness, stress, and anxiety. And after a brief period of time, in 60 healthy adults between 60 and 84, they all improved in those areas. They considered themselves healthy, but then they considered themselves much healthier after taking just the curcumin. So this should be part of your protocol as well. And this looks at the bioavailability of free curcumin versus non-free curcumin. On the left, you'll see the big blue with a very small stripe in it. That's phospholipid curcumin alone. Longvita is optimized. So the free form curcumin is brain permeable. That's the name of the game. The one on the left that's blue is the glucuronidated, not brain permeable. So you want to get free curcumin crossing the blood-brain barrier, not getting trapped in the liver, and turning the brain on, decreasing inflammation. This shows some more of that type of bioavailability. Neurophenol, standardized, clinically researched blueberry and grape extracts that supports memory in older adults. And you can go back and take a look at Dr. Heim's conference, which was the first phase of this webinar, talking about the polyphenols and neurophenol. So this is an important antioxidant polyphenol compound. Now, of course, supplements don't replace foods, right? So you want to encourage your patients to eat organic food, especially blueberries, blackberries, raspberries, strawberries, low carbohydrate fruits. Eat a lot of fats in their diet, things like olive oil, coconut oil, flaxseed oil, raw nuts and seeds, and whole foods, right? So organic vegetables, where 80% of the diet is vegetable-based. Keep in mind that the Mediterranean diet study that looked at heart disease found that after following the Mediterranean diet, there was a 50% reduction of stroke and heart attack. The study was actually discontinued because the results were so profound. They later went back and looked at memory and found that the Mediterranean diet also had a very profound effect on memory. So if you do something akin to a sugarless diet, high fat, moderate protein, low carbohydrate, heavy vegetables, and antioxidant nutrients, then you combine the nutrients that we're talking about, you're going to have profound effects on people's memory, focus, concentration, multiple sclerosis, Parkinson's disease. Maybe not cures these problems, but markedly improve the person's quality of life. And neurophenol has been found to support episodic memory. So, people have errors in their judgment, errors in their memory. When you take neurophenol compounds, polyphenol compounds compared to placebo, you have less likelihood of making errors. Well, I think that translates into a lot of daily activity. You have less senior moments. It also supports episodic memory. So there's better recall and better total recall of using neurophenol versus placebos. Pterostilbene is a common nutrient that I use in my office. It's the methylated version of resveratrol found in blueberries. It has a longer half-life than resveratrol. That's very important. So you want to keep it in the system for longer periods of time. And preclinical research suggests it may support healthy lipids, antioxidant status, cognition, and immune balance. And you typically give 50 to 100 milligrams a day. So I like to use this drugless prescription as well as part of our protocol. Lutein, zeaxanthin in the brain. They're primary carotenoids in the macula in the brain. And there's been a positive association between cognition, macular pigment density, and zeaxanthins. So, this is the substances that makes flamingos pink, right? So this is a powerful antioxidant that has a significant effect on vision, but also an effect on cognition. It decreases inflammation, provides antioxidant defense, and promotes the stabilization of the membrane. Remember, these membranes are made of fats, and these fats can destabilize. So if you have excessive toxins and poisons, those are free radicals. They're damaging your cell membranes in your brain. So you want to protect them. And that protection is lutein, zeaxanthin, phosphatidylcholine, phosphatidylserine. Get more circulation by using the periwinkle plant. Stabilize the cell membrane with things like DHA and EPA, free-form curcumin. Huperzine A is derived from the Chinese club moss, promotes healthy acetylcholine levels, and so it promotes cognitive function and memory in elderly. There's a randomized control trial, 50 patients taking 0.2 milligrams of Huperzine A and 53 patients placebo for 8 weeks. They in turn were evaluated on the Wechsler memory scale, and the results showed that patients that took the Huperzine A showed improvements in their memory, which was significant, and that it was better than using a placebo. So it's not just like, hey, take this. There's some good scientific studies that indicate that the choices that you're making for your patients are going to have good effects. Ginkgo biloba in the brain promotes blood flow to the brain. So what do we have as people age? Circulatory distress. Now you might run a carotid Doppler or an MRA and it may be normal. What you can have though is small blood vessel disease, which is very common. So you get your small blood vessels, the arterioles, capillaries that become damaged. And as a consequence of that, you have inadequate blood flow. So you get adequate blood flow along with problems with a compromised blood-brain barrier and lack of antioxidant nutrients. You've got a storm that eventually is going to take your brain down. Using ginkgo provides an antioxidant effect, improves capillaries and blood vessels, and platelet function. And if you take a look at the ginkgo leaf, it actually has it's a herbal stigmata. So that if you look at it closely, it actually looks like the brain. The memory prescription, something that you definitely want to do with your patients. Diet and lifestyle, aerobic exercise, 3 hours a week. Now the studies that have also been done by Dr. Bredesen at UCLA found that sleeping 7 to 8 hours a night, getting aerobic exercise at least 3 hours per week, eating a high-fat, moderate protein, low-carbohydrate diet, the low-carbohydrate diet of your choice, along with antioxidant nutrients and chelation, along with bioidentical hormones, reverse multiple cases of people with mild and mild to moderate dementia. So you can do this in your office. Add EPA DHA, 2 to 4 grams per day. Use Longvita curcumin, 400 to 1200 milligrams a day. And remember too, I showed you the studies about curcumin done among people that have good function. They don't really have a lot of complaints. But after 8 to 12 weeks of taking just curcumin, they noted improved rest, improved alertness, less anxiety, better sense of well-being. Neurophenol as an antioxidant, at least 600 milligrams a day. Methylated resveratrol, 50 to 100 milligrams a day. And so this breaks down that supplementation. You know, the curcumin, you could use an ultra preventive for people 50 years of age and older. You definitely want to have a comprehensive multiple vitamin with additional neurophenol. The methylated resveratrol, curcumin, pterosobane, and the quell fish oil, which has the EPA DHA plus vitamin D. Other ingredients to consider, I mentioned phosphatidylserine, phosphatidylcholine, astaxanthin, zeaxanthin, methyl B12, glutathione, D3 probiotics. In my office, we also do intravenous chelation therapy, upper cervical chiropractic manipulation because of the myodural bridge, big impact on memory. Bioidentical hormone replacement therapy is very important as well, or at least plant-based. Bioidenticals play a very important role in peptides as well. So I appreciate you attending tonight, and if anyone has any questions, they can put them through to our moderator, Christy Belhovic, and I'd like to thank you for attending. And I have my contact information in the event that anyone needs to send me an email or needs additional information or edification.
Great. Thank you so much, Dr. Gallagher. I appreciate all the great information, some really good takeaways here, some supplement protocols as well. While we're waiting for any questions to come through, I just wanted to announce again that the Douglas Laboratories new multivitamin, that Ultra Preventive 50 Plus, will be available next month in about mid-March, and it does have that neurophenol proprietary berry blend to support cognition and memory. It also has a clinical dose of lutein and zeaxanthin for vision and cognitive support as well. And that can be coupled with our optimized curcumin product with the neurophenol. So you're going to get your clinical dose of that berry blend in there and have a full cognitive support protocol. So just a couple questions here. And as well, I just wanted to remind everyone that this is recorded and you will get a copy of the recording in your email. So like I said, just a couple questions have come in. I know that you went over a lot of different supplements. I think sometimes patients are on a fixed budget and that might be a concern. Is there anyone in particular that you really like? I know we talked a lot about curcumin, and I know that you like fish oil. So just if you had to pick out of, the list, is there anything in particular?
I would say the following. First of all, if you're talking about a restricted budget, I would definitely do the multiple antioxidant. Unfortunately, many of the formulas in the Douglas Laboratories have the methylated form of B12 and folate, because some people don't methylate very well, and that leads to chronic brain inflammation, which can contribute to the problem. So I'd say start with that for sure. That needs to be part of it. I would definitely do supercritical DHA EPA. So I'd make sure that you have the Quell DHA EPA. It's about 7 times more effective, better absorption, decrease inflammation. And let's face it, what's your brain made out of? It's made out of fats. I would also add free-form curcumin. So the curcumin that I was talking about, so the curcumin is bound with phospholipids. The Longvita developed the technology for this so that we know that it penetrates the brain when it's taken that way, as opposed to just taking curcumin. Curcumin ends up in the liver glucuronidated, so the absorption is very poor. Although even that poor absorption is oftentimes effective, you want to get the big effect. So I would at least do those 3 things. Vitamin D is pretty inexpensive, so having 5,000 to 10,000 units of vitamin D could complete your program. That could be a very basic program that you could do. And then put the patient on a low carbohydrate diet. Carbohydrates are major inflammatory agents to the gut and brain. And a lot of people have chronic systemic candidiasis, fungal problems, and toxic metals. So putting them on low carbohydrate diets, get them exercising 3 times a week, total of 3 hours a week does the trick. That alone, and then have good oils in your diet, things like extra virgin olive oil, coconut oil is a good idea, flaxseed oil, eating raw nuts and seeds, wild caught fish, fatty fishes, grass-fed meats, and a source of good water so that you're not drinking tap water. So having things like reverse osmosis water or triple membrane filtered water is a good idea too, and drinking a lot of it.
Great, that sounds like a good plan. And I know we didn't get into too much detail on, I know you mentioned chelation, but do you think that heavy metal toxicity could definitely, be playing a role in someone's memory decline?
Absolutely. The chelation studies have shown that by having a series of 36 chelation treatments compared to people having placebo, and this is a study that was conducted by Medicare, a 10-year study nationwide, there was a 50% reduction in stroke and heart attack among the most difficult group of people, which are diabetics with pre-existing heart disease. It's the most difficult group to treat. Yet there was a 50% reduction of stroke and heart attack with chelation alone. By the way, it was chelation and taking a multiple vitamin. So take the multi. Chelation, the other part that has not been studied extensively is the role of toxic metals. But I can tell you clinically, observationally, we treat a lot of patients with intravenous chelation therapy, and chelation therapy is a great way of mobilizing toxic metals and also getting the vasodilation that you need and the anti-inflammatory effect on your blood vessels. So yeah, we oftentimes, like when people have neurological problems, I recommend chelation. For those of you who don't chelate, this is where you want to use extra amounts of vitamin C, extra amounts of glutathione. So you can take an N-acetylcysteine or reduce glutathione. Green factors, I use one of the formulas from Douglas Labs that has high concentration of greens. We call them super green factors. Those have very profound effects. Those are very powerful antioxidants, and they're promoters of detoxification. So they have things like watercress and wheatgrass and cilantro and parsley and other types of greens that promote the mobilization of toxic metals and lowering body fat. You know, why do they say don't eat fatty fish when you're pregnant? Well, fatty fish, like tuna fish, has the toxins in the fat. Well, the toxins are in our fat as well. So that if you lower your weight and body fat, you've released a lot of the toxins out of your system. So, you know, you can create your own forms of chelation too.
Yes, and I've heard from other doctors that intermittent fasting is a great way to immobilize those toxins and help get rid of all of those metals. So that's an option as well.
Yeah, that's a good point. Absolutely. You know, these studies go back almost 40 years ago. Alan Cott, MD, psychiatrist in New York City, would treat psychiatric patients with fasting. And it was based on studies that were done in Russia at the time, where they took into Moscow mental health patients that failed conventional medical treatment, and they fasted them for 30 days and exercised them for 1 to 3 hours a day, with very dramatic improvements of bipolar disease and dementia and anxiety and depression. So intermittent fasting, where you fast, you know, at least 12 hours from your evening meal to the next meal, periodically having a 24-hour or 48-hour fast, going into ketosis, having a ketogenic diet, and then adding some carbohydrate in your diet periodically is a really good thing to do. Remember, we have two metabolisms. We have sugar metabolism and we have fat metabolism. So we can run on sugar and we can also run on fat. And for a lot of patients with brain inflammation, running on fat is a good idea. So intermittent fasting and ketogenic diet.
Yes, absolutely. There's a lot of research out on that. So that's
Yes, and we
wonderful
have patients
idea.
too with seizure patients, migraine patients. You know, they're linked to disturbed carbohydrate metabolism and brain inflammation. So our seizure patients, we put them all on ketogenic diets. We put them on high fat, moderate protein, low carbohydrate diets.
Great, thank you. And then the last question that came in was about brain fog in terms of hormones. So how would you be able to differentiate, you know, if it's maybe low testosterone or something like that versus like a memory decline?
Well, that's a good question. And here's what you have to think of. You know, we tend to be reductionist in the medical system. So the reductionist is like looking for the sole cause of the problem. For a lot of people as they age, it's multifactorial. So there's multiple risk factors and then multiple steps that you have to take. That's why, you know, the studies look at, for instance, phosphatidylcholine, phosphatidylserine, periwinkle. But does anyone really do that in their practice? I mean, I don't, and I've been practicing for 40 years. I think holistically. So I think, what are the contributing factors why this person can't remember, why they can't focus, why they can't concentrate? And if you're a male that's 55 years of age and older, you're a female that, you know, you stopped your menstrual cycle, you're hormone depleted until proven otherwise. So we look at 24-hour urinary hormone tests. We identify what hormones are missing. We put those back in males, testosterone, sermorelin growth hormone, various peptides, DHEA, females, estrogen, progesterone, testosterone, DHEA, oxytocin. The effect for some people is dramatic, where you could say, wow, that appears to be the sole cause. But quite frankly, the majority of people, you've got to do the things we're talking about. Change the patient's diet, supplement their diet, get them exercising, do the natural healthcare techniques, detoxify them, get rid of metals out of the system, supplement their diet. And supplements include hormones. So hormones play a major role for some people and a role for other people. If you'll take a look at Bredenson's work at UCLA, he gave people bioidentical hormones and chelation therapy in conjunction with the very things we're talking about. I do the same thing in my office. I don't limit it to one thing. So I don't say, well, is it just an estrogen deficiency or just a testosterone deficiency? I'm not going to make that kind of experiment or call. I'm going to change the patient's diet, detoxify them, supplement their diet, chelate them, put them on the series of vitamin therapies that I just mentioned, and give them the opportunity of improving, because there's really nothing in medical care that improves a patient's brain health. There's nothing out there. The drugs that you read about, like Namenta and some of these other drugs, really are designed to delay the onset of going into a nursing home by 1 year. I mean, that's their major claim to fame. They're really not doing anything to restore brain function. You have the capacity, based on this information, to change a patient's brain function and give them improved quality of life.
Right. It's definitely a multi-pronged approach, so I appreciate that very comprehensive answer.
Yeah,
Right.
think of the wheel with lots of spokes in it. You've got to deal with all the spokes to make the wheel run.
Exactly. All right. Well, thank you so much, Dr. Gallagher, for your time tonight, and we really appreciate all the valuable information that we learned. And I want to thank all of our attendees as well for joining us, and please check your email for the recording. And we look forward to seeing you on the next webinar. Thank you, and have a wonderful evening.
Thank you, everyone.